This is the WMAY Business Spotlight. I'm Greg Bishop, and we're talking with Dr. Camille Dunkley here with National Prevention Week. Doctor, thanks for taking time with us here on WMAY Business Spotlight. So for people who aren't familiar with what National Prevention Week is, what is National Prevention Week?
Yes, well, thank you so much for having me. So National Prevention Week is a public health platform that promotes substance use prevention and promotes positive mental health. It is annually, and it usually occurs in May, and each day of the week it's highlighted with different substance use disorder. For example, opioid use, underage alcohol usage, tobacco use, illicit substance use, and then the last day is preventing suicide.
So this, of course, is an important topic, not just for individuals, but also for families, I would imagine. Why is it so important that this is an issue that's talked about, not just in the month of May, but all the time?
Yeah, I think it's important because bringing awareness to these issues and speaking openly within the community and with patients and with family members helps to reduce the stigma. Substance use disorder and mental health issues is something that affects everybody within the community, whether that's something that someone is personally going through or whether it's a family member that they know is also having issues. And I think that before, or at least previously in the past, a lot of these issues were kept very private and people didn't necessarily feel comfortable speaking about them openly with their children or with other family members. And unfortunately, that led to a lot of people not necessarily seeking help or finding out the resources that are available in their community. And so I think that by highlighting a lot of these conversations that are ongoing throughout the year, hopefully that will promote more people feeling comfortable getting care, getting services, accessing resources, and getting the help that they need.
You raised the issue of the stigma created here, and I do want to pause on that for a moment and just talk about, I guess, the impacts on the individual from that stigma, for them not being able to break free from that and get the help they need. How can they best address that internally?
Yeah, I think that a lot of the stigma is not only around whether other people are experiencing these issues, but also they might be feeling bad about themselves kind of experiencing these issues. And so I think that the stigma in some ways makes people shy away from getting help. They're not sure how they're going to be received when they ask for this information, what people are going to say, what people are going to think. And so I think that by reducing that stigma, hopefully people will feel like they can really get help and that people care about them and that they'll feel more positive about their situation and what they can do in order to get healthy again.
This is the WMAY Business Spotlight. We're talking with Dr. Camille Dunkley with SIU Center for Family Medicine about National Prevention Week and the importance of highlighting substance use disorder and the mental health impacts that it can have on individuals and their families. So talk again about the importance of raising awareness about this topic in a national conversation.
Yeah, I think that raising awareness is key in this conversation because it helps to normalize a lot of these issues that everybody in the community are experiencing. And by normalizing these issues and allowing people to talk openly about them, hopefully more people will come forward and ask for help and seek the services that they need.
When it comes to the issue of substance use disorder, sometimes people may not be willing to talk about it. What are some things that family members or loved ones can possibly see as signs and indications of substance use disorder?
Yeah, I think it can be difficult because sometimes people can be very private, but I think the main thing is just being there and being available and letting people know that you can, if you feel like you can be a resource for somebody, or if you feel like you can offer help for somebody, just allowing them to know that you are there and you're available if they do need the help.
There's a lot of services that SIU Center for Family Medicine offers. What does SIU offer up for those who may be battling substance use disorder?
I think that a great place to start would be talking with your primary care provider. I think that because someone already has a relationship with that provider, they might feel more comfortable asking those sort of questions and finding out what resources are available. So I think that the initial set point would be definitely trying to contact your primary care provider. there. After that, we also do have a MAT clinic, and MAT stands for Medication Assisted Treatment, and this is a program for patients with opioid use disorder specifically. Here within that clinic, we use Suboxone as therapy, and Suboxone is a medication, and it works in the brain the same place as heroin and morphine and other opioids, but it works a little bit differently. And so it's supposed to help with the withdrawals and the cravings, but not necessarily supposed to give that high or that euphoria sometimes people speak about. As a part of this program, with your medical visits, there's also group counseling available, individual counseling available. And for patients who have transportation difficulty, we also have a van that can take patients to their medical appointments as well.
Important stuff for family members to hear, also for those who are experiencing substance use disorder. Of course, SIU Center for Family Medicine has the capabilities to help you get through this time for those who are suffering with substance use disorder. Tell us how people can get a hold of SIU Family Medicine and maybe get some more information about substance use disorder.
Absolutely. So to get a hold of the SIU Family Medicine, you can call the 217-545-8000. In order to get more information in terms of the substance use disorder or opioid use disorder and the MAT clinic, you can call 217-545-4781. That is a direct number for the MAT clinic nurse. And whether you just want to get more information or find out more about how the program works or how Suboxone works, that is a direct number that you can call. And you don't need a physician's referral in order to make any appointments for the MAT clinic.
There is help right around the corner for you, and you can find that with SIU Center for Family Medicine. Give them a call at 217-545-8000. Dr. Camille Dunkley with the SIU Family Medicine, thank you so much for taking time with us here at the Business Spotlight on WMAY.
Yes, thank you for having me.